When physical therapy doesn't work for running injuries, what should you do? Today's episode follows a discussion that I had with one of our running coaches, Heidi, the other day, as she'd been having a bit of knee trouble for the last little while. So she started having knee trouble a few months back, and she was trying to essentially fix it on her own. So she was trying to adjust her training, do some certain exercises and stuff. She worked with a local physio. And a few weeks later, she was still mentioning it. So at the time, I suggested that she sort of enroll with us for our 12-week program, right? So that's our recovery program. And it's what we use to help injured runners get back to pain-free running. And I suggested that she do that because it didn't seem to be going away on its own. And most running injuries that are more like niggles will resolve within 4 to 6 weeks. So if you have pain when you're running, and it's been less than 6 weeks, it's not the end of the world to kind of just leave it alone. It's better to treat it sooner, but it's okay if you don't, because most will go on the way on their own. However, if it persists beyond 6 weeks, the chances that it'll go away on its own are much, much lower. So I suggested at that point that, she work with us and we essentially just fix the problem. So it's about 15 weeks later now, and I was chatting with Heidi, asking her how her knee was, and it's totally fine. So she's prepping for her first race of the season. The knee pain is gone, and she's back to full training. And I said, what was the difference? What do you think happened when you started working with us in the program, as opposed to what you'd been doing, when you were trying to get rid of it on your own? Because obviously she knows what she's doing, right? She's helping our clients with it all the time. And she said the big thing for her was the accountability. So although she knew kind of what to do before, she just wasn't really doing it. And then once she started working in the program, she knew that I was going to be reviewing everything she did. So I'd written the plans for her, and I was going to check on her execution of that plan and see how it was going. And if she wasn't doing something, I would just be like, hey, what's going on? How come you didn't do this one? Anything need changing, all that kind of thing. So having just that awareness that someone was going to review it forced her to execute the plan. So that was the one big thing. And the other thing is that she had a plan now. So it wasn't just that she was sort of on her own, sort of improvising 1 week at a time. She had a plan given by like an external source. So it was me in this case. I'd given her a plan. There's like, this is how we're going to resolve the knee pain. So you have to execute on this plan. So she could see the path in front of her, and that encouraged her to do the work. And when she did the work, that's when she got the results. And what followed was basically a big rant from me. So we had a discussion, but really it was just me talking. And what I was sort of sharing was that really is a big problem in the kind of physiotherapy world, and a big frustration of mine. So one of the things is that if you look at, well, before I start talking about that, like, my intention with this episode is not to kind of badmouth physiotherapy in any way, but a lot of good physios really don't get the results that they could with their clients. And it's not really their fault. They know what to do. They're just kind of a little hamstrung by the model that they're working in. And it's basically the sort of session by session model. So if you're working as a physio, whether you're in private practice or you're in the public healthcare of whatever sort, it doesn't really matter. It's almost always, like 99.9% of the time, it's going to be a session by session model, meaning sometimes you'll have a client enroll for like a package of 6 sessions or 12 sessions or whatever it is over a period of weeks. But most of the time, it's just going to be one session at a time. And there's going to be very little, if any, communication or back and forth in between those sessions. So you have that time, whether it's, some clinics, it's really like 10 minutes. Most of the time for me, it was more like half an hour with a client. Sometimes it's longer depending on the issue. But then that's what you get, right? That's how you are trying to fix the issues. Within that time, you're going to do some stuff with them, and then you're going to give them some stuff to do, and then you're going to see them at the next session, and that's the next time you'll talk. So this session by session model, as you can tell, I have a lot of like beef with it. And the reason is that it was really hard to get results in that particular way of working, specifically for running injuries. And that's because with running injuries being repetitive stress injuries, you're not like in acute pain usually. It's not like you're walking around and you can't do your work, you can't like sort of sleep or whatever because of the pain. And physical therapy sessions are great for that, right? It's when you run, it hurts. And when you don't run, it doesn't hurt. That's mostly the case. So when you have a session by session model with physio, usually what you'll do is some manual therapy of some description with the injured runner, and some sort of like maybe technique or biomechanics work. Maybe you'll review the shoes, look at their running technique, whatever it is. And then you'll usually give them some sort of home exercise program, or HEP as it's abbreviated to in the chart notes. So the home exercise program is really where you're trying to make a difference in their kind of ability to tolerate the stresses of training outside of your 30 or 60-minute appointment or whatever it is. The trouble with the home exercise program is multitude, but we'll get to that. Well, actually, we'll tackle that first. So the first problem is the home exercise program. And the second problem is far more significant. And that's the reason why I think that most of the time, or often, probably most of the time, physical therapy doesn't work for running injuries. So the first one with the home exercise program, there's a couple of issues. The first is that often it just doesn't get done. So whether it's most of the time it's better with runners because they're very motivated to address the issue, but a lot of the time the individual, like the patient or whatever, who's given the exercises doesn't do them. So in research studies, when they measured it, it's like adherence, as they call it, like actually doing the program, is like 40 to 50%. And that's like in people who signed up to do a study where they said, we're going to measure how often you do these exercises. So you can imagine that's like a best case scenario, right? So adherence is low, below 50%, meaning they're doing less than half of what they're given. So that's one problem with it. And the other problem with it is that often, and this wasn't really the case for me, but often you'll get given some exercises by your physical therapist, right? And it's maybe on a sheet, or maybe there's a video, or sometimes it's in apps now. But then you go back and week on week, sometimes they're swapped out for something else. Often they're just left the same. But there's no like logical progression from one week to the next. There's no real like plan for how to progress you over the next 8 weeks. There's no tracking of the load that you're using usually in terms of making you stronger, more powerful, able to jump further, or whatever it is. That progression is almost always not there. And what happens then is you do the exercises for like a week, maybe 2, and at first they're like usually too light, body weight or bands, and you adapt to that stress, right? So you get a little bit stronger, your balance gets a little bit better or whatever it is. And then like you just plateau, right? So there's no more stimulus to adapt because your body is already adapted to that stimulus. And at that point, continuing to do those things is maintaining where you are right now. It's not going to make you any stronger, any more balance, any more plyometric stress tolerance, or any more anything, right? It's just going to keep you where you're at. And then the second problem, which is far, far bigger, in my opinion, is that there's no guidance on what to do with your running, or very little. So the way I would do it when I was a physio in the clinic is, I'd be doing the manual therapy or the exercises or the technique evaluation or whatever it was that we were doing. And while I'm doing that, I'm trying to ask the runner, how did your running go this week, right? So what did you do exactly? What did you feel? When did you feel it, right? And I'm trying to get a reasonably good idea in that sort of 5 minutes of what actually happened over the last week, how the pain behaved and how well it tolerated the stress applied to it with the running. And then from that, I'll give you some rough guidelines for the next week or 2, however long it's going to be until our next session when we get to talk again. And then I'll hope that that works, right? So I'll hope that it's not too much or not too little. And that, I mean, when you consider the primary stress that's going through the injured area when you're talking about a running injury is running, right? So when you're running, you've got about, let's say your knee, right? So 3 times your body weight experienced the stress on every step when you're running. And if you multiply that out, if you take an average female runner, it's somewhere in the region of about 2 million pounds worth of force going through the knee every hour, right? So we probably need something a little more specific to titrate and regulate that stress to make sure that if the injury's in the knee or wherever it is, that it is not too much, not too little, and just the right amount to make sure that it's adapting week by week and getting more resilient and less sensitive, right? So when it comes to physical therapy, most of the time, there is no guideline there. There's very little input into the training itself on how much to run, how often, how fast, how to divide it up, how to put intervals, when to put certain runs back to back, when not to, when do it on the same day as strength training, when not to. Right? There's just really very little opportunity in the session by session model to actually build a plan and then have the athlete execute that plan and then adjust it in real time depending on how it goes, right? So that's the second problem with the session by session model. And that's far more significant for me. And that's the reason I think most of the time, if you have a repetitive stress injury from running, like a running injury, it's been going on more than a couple of months and you've been trying physio and that kind of stuff, this is why. If you have a repetitive stress injury, like running injuries are very simple for me. There is more stress being applied to that tissue, whichever one's hurting. There's more stress being applied to it by your running than it can adapt to. That's it. End of story. Right? That's why it hurts. So there's reasons for why there's too much stress, but that is the ultimate problem. So if you're not regulating that stress by controlling the amount and quality and intensity of the training, i.e. the running, then you cannot possibly hope to control how it adapts to that stress. And that means that most of the time, if you're not doing that, if you're just giving a home exercise program and you're not controlling the running, you're essentially just hoping. You're hoping that they don't do too much or too little and they just happen to get it just right based on the very limited ability you have to give them a little bit of guidelines during the session. So if you're gonna fix the running injury, right, you need to place the amount of stress on that area that it can adapt to, and then increase that stress systematically as it adapts and becomes more resilient to get you from the amount of running you can do now to running as much as you want. Now, the problem I had is I had almost no control of the training, right, the running. I was trying my best with the home exercise program in terms of the strength and control and technique exercises, but I really didn't have the opportunity to control the training in any significant way. And I would hope that by the time the runner came back, 1 week, 2 weeks, 3 weeks later, whatever it is, that the guidance I'd give them had worked and they were able to run a little bit more. Anyway, so these were the kind of frustrations I was experiencing when I was working in the clinic. And that was until I met Mike. And Mike, you guys may remember, if you scroll back a fair way in the feed, we had him on the podcast a while back because he'd come to me in the clinic with issues with his Achilles tendon. And the session by session model had worked relatively well because he couldn't run at all, right? So what we did is we give him a home exercise program of loading exercises for Achilles. And each week when he came back, I would progress them a little bit. And because Mike's very disciplined, he did the work. And what happened is his Achilles was able to tolerate more stress. And after a few weeks, we were starting to run again. And I gave him these loose guidelines about how much to run. And most of the time it was okay. Sometimes it flared up a bit. Sometimes it wasn't enough. We could have done more. But most of the time it worked okay. But as we got further and further on, he was thinking, I'm feeling better about this Achilles now. I want to train for a half marathon in I think it was 3 or 4 months. I can't remember. And, at that time, so he comes in one day with a spreadsheet and he'd printed it off and he handed it to me and he said, this is my plan, for how to get from where I'm at to run that half marathon now that my Achilles is feeling better. And I looked at it and I was like, you can't do that. You're just definitely going to get injured straight away. There's no way your Achilles is ready for this. So I was like, there's sprint intervals on there, which you're not ready for. We haven't prepared for that. You have back-to-back runs, which is not good for tendons typically in this stage. And it's just going to flare your Achilles up and all the good work we've done is going to be completely ruined. So I sort of scribbled all over it and I just kind of redid it as best I could. And then he went away for a week and did that. And when he came back the following week, he'd filled in on the spreadsheet what he'd done and how he felt. And so we had a bit of an odd physio session because we sat down in front of the plinth, which is the bed, and just I got the laptop up and we just went through what he did. And then we planned out the next 3 or 4 weeks of training in a little Google spreadsheet for him. And I essentially used that to prescribe his training, right, in terms of the running based on where he was at. And then I shared that document with him and he filled it in. And then he came back a couple of weeks later and it went relatively well, right? And so at that time, I was thinking about, well, how could I incorporate more control of the training for my runners? How could I practically do that, which isn't relying on me trying to just get it done really quickly in these sessions every few weeks? And so I proposed to Mike that, we look at doing a coaching kind of program, which is kind of a hybrid between the physio and the coaching. And I would essentially connect him to a training app. We used Training Peaks at the time and prescribe his running in there. And then he could give me feedback on how it felt, right? Better, worse, fine. And then we could use that to progress his running volume, running intensity week by week. And we could adjust it in real time depending on how it behaved. And then Mike became my kind of beta tester, right? My little test dummy for this process. And at that time, as I was thinking of doing this, I spoke to another few clients about it so that we had 4 to start with who were similarly doing really well with their running injury, ready to go back to running, but not ready for full training, right? So this is what I now call the gray zone. So they're a bit too good for physio, right? Where physio, they don't need like manual therapy and in-session treatment anymore. But they're not good enough for full training, right? So they can't just go and run their half marathon. One of them wanted to do their first 50-mile race, right? Like they can't just go and do that. So how do we bridge that gap? That's the gray zone. And what would fill that gap eventually will become the recovery program, which is what we do now, right? So those guys did really well. So that year, as I was working with them, Mike went on to do that half, then he did a full, then he did a PR for the full, like by the end of the year. The other lady did her first 50-mile race. One of the others set a PR for her 10K without pain. So it went really well now that I had control of the training, not just the like home exercise program, but also the running. I was able to, when they, as they started to increase their volume and intensity, the injuries that they've been coming about, they started to complain again, right? Because they were fine at like 20K a week, but as they approached 40, 50K a week, the Achilles or the knee or whatever it was, then it'd start to complain. Then it'd start to get a little irritated. So then what I could do in real time is dial it back a bit, right? So I didn't have to rest them and they didn't have to try and train through it and ignore it because the plan told them to, right? Whatever plan they got off the internet. And we could adjust it in real time. And they would just message me in the app to let me know what was going on, and I could make tweaks. And that's how I was able to guide them through the year without any, significant flare-ups, and they were all able to achieve the goals. And I was like, okay, I'm onto something here. What I'd done inadvertently was to take the best of coaching, which is the planning, the programming, the progression, the accountability, the support in real time, the adjustments week by week as things need changing, and the best of the physio world, which is like the clinical reasoning, the diagnosis, the pathophysiology, what is wrong, the pain science that goes into deciding how to progress and when, and how to manage problems and differentiate like simple mechanical, repetitive stress injuries from things that are more serious that need to see like a doctor, surgeon, whatever it is. And I sort of smushed them together and came up with the program that would incorporate the best elements of both and allow athletes to have a plan that they would follow that had a reasonable goal given where they were at with their recovery. And we could keep in touch. So the accountability side of it, they knew what to do. And I knew if they were doing it. And I knew if they weren't doing it, I could talk to them about why. And they knew if they had a problem, they could ask me what to do. So they didn't have to wait 2 or 3 weeks till they see me again. They could just ask me in the app or message or whatever it was. And I could make changes. I could give them advice. If it was like pain with a certain exercise, they can take a video and send it to me and I could change it, give them technique advice. And this is how we were able to get them all back to full training. And then as the months passed, I essentially sort of systematized that. And then other runners who reached out, this is what we did with them. And what emerged became the recovery program, right? So it's 12 weeks at the minute, current iteration, right? We're always trying to make it better. There's 12 weeks. And what we do is we control the training, we control the loading in terms of the strength and the running. And then we gradually build you up from where you're at until it can handle more and more and more until you can do the amount that you want to do. And then we track the success of it by setting a 12-week goal. So we both agree at the start of the 12 weeks, what's the goal? So let me just pull a couple up to show you. So like these are just some random examples. Running with no hip pain, half marathon without injury, finish first marathon, marathon training without re-injury, training pain-free, trail races with no calf pain, running with no knee or back pain, training pain-free, right? So as the program has evolved, I've become more specific with these goals. So these are a little more general because they're earlier. But the idea was it's like a goal that in 12 weeks, we can achieve it if we follow the plan. And I can say, yes, you achieved it or no, you didn't. And then I looked at the numbers. So what I do is I put that in a spreadsheet and I put yes or no in a column beside it. And for our runners that we worked with last year, so we had an 88% success rate. So of all the runners that we worked with last year, 88% of them achieved their 12-week goal, which is something like what I just said to you there. And that for me was like phenomenal. That was so much better than what I was able to get in the clinic. And then obviously I sort of dug into the 12% because it's just like if your kid comes home with a report card and there's like 9 A's and 1 B and you're like, what the hell happened with the B? So I was like digging into the 12%, like what went wrong then? There was a mix, really. There was a bunch of different reasons. So a bunch of them were just they hadn't achieved it yet. So there was one or two where they hadn't got to the full amount that we'd specified. So one was like run 90-minute long runs with no knee pain. And we weren't at 90 minutes. We'd got to an hour, right? So they couldn't run at all when they started. And we got to 90-minute long runs because that's just as far as we could go without flaring it up. So there was a bunch of that 12% that didn't achieve their 12-week goal that were just, we just hadn't got there yet. We kept working together and we got there within, 1 or 2 months. Then there was a proportion where they had some kind of wrecking ball, right? So that's where like something came up, and it was often like an unrelated injury, like someone developed like a shoulder injury, someone fractured one of their bones like in a traumatic way. Like there was just these kind of random things that really, you can't control for. So I didn't really read too much into that because there's nothing we could do about it. And then the other one was the execution. So what we do is we track all of our athletes on the execution of the plan. So each week, it's actually Heidi who does this. She goes in and reviews everyone and tags them as green, orange, or red. Like green means they're doing like 80% of the work. Red means they're not doing any, they're doing like less than 20%. And then orange is in between, right? And what we found is that a significant amount of the people who don't achieve their goal are people in the red. So one of the things we work really hard on is making sure people execute the plan. So we adjust the plan for them if that's the problem in terms of like fitting it around their schedule or whatever, or if they're having like pain or whatever, or if they just need a little bit more encouragement, a little bit more accountability. And then, I think we've got like 2 athletes in the red at the minute. So it works really well because we have that accountability, we have that support. And most of the time, like for the vast majority of our athletes, this is, this actually executing on the plan is not an issue. And then it's only March as I'm recording this. So far this year, I just went through the results for this year for anyone who's finished their 12-week program, and it's 90% again. So it looks like we're settling in on that as a kind of typical value for us. So 90% success rate of achieving the resolution of a running injury within 12 weeks for me is like phenomenal, because I've been in the clinic as a physio for 20 years and it was not that good. Like usually what would happen, a runner would come in and you give them some stuff to do, and after a few sessions they wouldn't come back, and you kind of just hoped that it got better. Like you didn't know if it was they'd stop coming because it got better, or if they stopped coming because it wasn't getting better. It was the same thing. You reach out but often you don't hear back. And one of the reasons I wanted to record this podcast is because I hear this all the time from runners, the runners who talk to me on the free strategy calls and the runners that we work with. And they talk to me about these frustrations from the side of the table that you're on, right? So I wanted to give the side from the physio side, because the reality is a lot of the time, if you've done physio, especially if you've tried it a lot and it hasn't worked, it's sometimes but it's not usually because the physio doesn't know what to do. They're just kind of stuck in this session by session model. And it's really hard to manage your training load when you're doing it that way. And, for any physios that are listening, I would encourage you to look into other ways of delivering your services, because it's not as hard as you might think to transition out of that session by session model and look at something that has more control over the training, because that's where you'll really see the needle move for your patients. And so what I do with our runners at the end, like towards the back end of their 12-week program, is we do like a review call and we see how it went. And obviously, because 90% of them, we've resolved their issue, so they're really happy. And I say, because most of them have tried other stuff in the past and it didn't work. And I say, what was different here? Why do you think this worked when other things didn't? And it's very simple things. Like Heidi mentioned, the accountability of knowing that we're going to check on the thing, and if you don't do it, we're going to ask you why. Like that's a huge one. Having a plan that's progressive, right? So it's not just like do these exercises until I see you at your next session, and then I'll try and think of something else. Like there's a program of 12 weeks. Like it's not pre-written. We write it for you as we're going, but there is a plan for the next like 4-week block. So you know what you're going to be doing and you can see where it's going. So we have an objective over the 12 weeks, and that incentivizes you to do the work, right? Because if you do it, there's an extremely good chance that you're going to get what you want, which is back to pain-free running. And then the other thing they say is the adjustments. So they say they feel like they have a coach in their pocket, right? Because if they have some trouble, they send us a message and we can make real-time changes. So they don't have to wait like 2.5 weeks until their next session before their program is changed. Like they can just tell us and we can change it immediately. So if they're doing too much, we can dial it back before it gets irritated. If they're doing too little, right? And they're not feeling any pain whatsoever for all of their workouts for like 2 weeks. We can dial it up. We can push them on quicker. And that's how we're able to follow the injury as it adapts and ask it to adapt to the training stimulus at the rate that it is capable of adapting. So not more where it gets irritated, but not less where you're just kind of wasting time and doing things that don't have any effect. So it's pretty straightforward. Like they have a reasonable goal. They have a plan to achieve that goal. They execute that plan. We help keep them accountable to executing the plan. And if the things aren't going to plan, we make adjustments in real time. So it's very, very straightforward. And it's really not that complicated. And for me, like I said, running injuries are simple. They're simple, but they're not easy, right? If you put more stress on the area than it can adapt to, it'll hurt. If you put too little on, it'll just get weaker. If you put the right amount on, it'll become stronger, more resilient, and less sensitive, and you'll be able to do more the following week. So the goal is to get in that adaptive zone, right? That's the name of the podcast. Not too much, not too little, just right. And that's very simple. It's just not very easy, especially if you're trying to do it on your own. So if this is resonating with you and you've had this experience where you went to like session-based care, whether it was physical therapy, doctor, chiropractic, and again, there's a ton of value in all of those professions. And I know loads of people in those professions who do amazing work. But having worked in the physio profession for many years, I know its limitations. And the main limitations with the session-based model is lack of communication between sessions, lack of progressive planning, and lack of control of the training plan, right? So if this is resonating with you and you're like, yeah, maybe this is why the physio didn't work. Like this, my physio seemed really smart, but 18 weeks later, I was no better. I still couldn't run. I could still not run as much as I wanted to, right? If this is resonating, this might be why. And if you want to talk to us about potentially helping you with this to see if we can make some adjustments to the way you've approached it to see if our program will be a good fit for you to help you get back to where you want to go, then I definitely want to talk to you. So click the link in the description as always, book one of those free strategy calls. We'll have a chat. We'll see exactly where you're at. We'll see what you've tried, see if we can figure out why it didn't work, and see if maybe our solution might work for you. And then you can decide for yourself. All right. Have a good one.